Well, hundreds of people in Longview who rely on opioid medications for chronic pain have struggled to get their medication for months. More and more pharmacies have stopped refilling prescriptions, to one doctor's clinic in particular. Thomas Schultz joins us now from there. And Thomas, what's happening?
Well, Tim, Kirkpatrick Family Care is a doctor's office which has hundreds of patients with chronic pain. Now, these are people who may suffer from cancer or have broken their neck in the past or an assortment of other broken bones. And for months, chain pharmacies haven't refilled their prescriptions.
You know, I'd rather be out doing something than sit in a rocking chair looking out a window.
For more than 20 years, Mark Davison has been a patient of Dr. Richard Kirkpatrick. And for 8 years, Davison has been on opioid medications for chronic pain.
My back has been gone. I've got cancer. I've got quite a few other things.
Like arthritis and shoulder bones scraping against each other. And for years, he filled prescriptions at Safeway. But that's changed. Over the past 2 years, chain pharmacies have stopped filling Kirkpatrick's opioid prescriptions.
And then December 15th, Safeway abruptly stopped.
And then all of a sudden came up, they wouldn't fill it no more.
And patients were left scrambling to find another pharmacy. Davison is working to get his filled through an independent pharmacy. But to fill opioid prescriptions, he says the pharmacy requires all his medications go through them. For 3 months, he's tried to switch over prescriptions, though Sunday, he ran out of opioid medication. Other patients in similar situations are turning to desperate measures.
You know, some of them are going out on the streets and getting heroin.
Kirkpatrick says chain pharmacies stopped filling prescriptions due to a 2021 national opioid settlement, which created red flag thresholds for opioid prescriptions. Kirkpatrick says flags are raised if pharmacies prescribe an inordinate share of opioids in their areas. But when many pharmacies stopped filling opioid prescriptions from Kirkpatrick's office, he was forced to turn to a smaller number of pharmacies for more orders, creating a cascading effect of flags being triggered. Recently, he says Cardinal Health, the drug distributor in Longview, has told independent pharmacies not to honor Kirkpatrick's opioid prescriptions.
So that just takes us right out, because we have a lot of patients that no one else will take care of.
A local pharmacist told us he agrees with Kirkpatrick. Many patients aren't being adequately served. Kirkpatrick says he's reached out to Cardinal Health, but nothing changed. We asked the distributor for an interview too. We never heard back. And over time, Kirkpatrick has taken on more patients with chronic problems because other doctors won't prescribe opioids. Instead, he says doctors offer treatments like therapy and acupuncture.
The other options are perceived by the patients as being uncaring.
Leaving many patients like Cheryl Sharkey.
I've had back surgery. I've had knees replaced, shoulder replaced, metal in my arms, broken wrist, you name it.
Uncertain what's in store for their future. And Cheryl Sharkey told us, like others, she hasn't been able to get her medication and she doesn't know what's in store for the future. Now, Kirkpatrick says some of his patients have turned to other means, like getting fentanyl or heroin off the street in order to cope with their pain. Tim?
Wow, that's a scary proposition. Thomas, thanks a lot.